What are the signs and symptoms of a baby being fully engaged in the pelvis?
In this video, we'll discuss the signs and symptoms of a baby being fully engaged in the pelvis. This process, also known as lightening or dropping, usually occurs a few weeks before labor begins, but can vary depending on the individual pregnancy.
What does it mean for a baby to be fully engaged in the pelvis?
A baby is considered fully engaged in the pelvis when its head has moved down into the pelvic cavity, settling into a position that allows for a smoother passage through the birth canal during labor. This is an important stage in the final weeks of pregnancy, as it prepares both the baby and the mother for the upcoming labor process.
How can you tell if your baby is fully engaged?
There are several signs and symptoms that indicate your baby may be fully engaged in the pelvis. Here are some common indications. 1. A lower abdomen. One of the most noticeable signs is that the pregnant mother's belly will appear lower, as the baby has descended into the pelvic cavity. 2. Increased pressure on the pelvis. Mothers may feel increased pressure or heaviness in the pelvic area, as the baby's head is now resting on the pelvic bones. 3. Easier breathing. As the baby moves down, there is typically more room for the mother's lungs to expand, which can result in easier breathing. 4. Increased need to urinate. The baby's head pressing on the bladder can cause a more frequent need to urinate. 5. Changes in the cervix. A healthcare provider may notice changes in the cervix during a prenatal checkup, such as softening or effacement, indicating that the baby is engaged.
When does a baby typically engage in the pelvis?
The exact timing for when a baby becomes fully engaged in the pelvis can vary. In general, first-time mothers may experience engagement around 36 to 38 weeks, while mothers who have given birth before may not notice engagement until just before labor begins.
Is it normal for a baby not to engage until labor begins?
Yes, it is completely normal for some babies, especially those of mothers who have given birth before, not to engage until labor begins. In these cases, the baby usually engages during the early stages of labor. However, if you have concerns about your baby's position or engagement, it's essential to consult your healthcare provider for guidance. In summary, signs of a baby being fully engaged in the pelvis include a lower abdomen, increased pressure on the pelvis, easier breathing, increased need to urinate, and changes in the cervix. The timing of engagement can vary, and it's normal for some babies not to engage until labor begins. Always consult your healthcare provider if you have concerns about your baby's position or engagement.